Surgical hand scrubbing. The goal is to remove as much gross contamination and microorganisms as possible from the skin of the hands and forearms before donning sterile gloves and gowns. Remove rings, watches, bracelets, or any other hand jewelry. Make sure that you are wearing your mask and cup properly and securely before starting the scrubbing process. Gowning and gloving. The objective is to prevent contamination and help control infection and microbial contamination by skin flora via aseptic principle and standard precautions. Normal delivery. The end of the second stage of labor is heralded as the perineum begins to distend, the overlying skin becomes stretched, and the fetal scalp is seen through the separating labia. Steps include perineal support, delivery of head, delivery of shoulders, cutting of umbilical cord, and delivery of the placenta. Monitor for the fetal heart rate and maternal blood pressure. When the head distends the vulva and perineum enough to open the vaginal introitus to a diameter of 5 cm or more, a gloved hand may be used to support the perineum. As one hand supports the perineum, the other hand is used to guide and control the fetal head to avoid explosive delivery. Slow delivery of the head may decrease the lacerations. The cardinal movements of labor includes engagement, descent, flexion, internal rotation, extension, external rotation, and expulsion. Essential intrapartum and newborn care or unang yakap. This is a package of evidence-based practices recommended by the DOH, PhilHealth, World Health Organization as a standard of care in all birth by skilled attendants in all government and private settings. Unang yakap has 4 steps. First is immediate drying. Using a clean, dry cloth, thoroughly dry the baby, wiping the face, eyes, head, front and back, arms and legs. Next step is to place the newborn prone on the mother's abdomen or chest for skin-to-skin contact. Third step is to clamp and cut the cord after cord pulsations have stopped. Observe for oozing blood and note not to milk the cord towards the newborn. After cord clamping, ensure oxytocin is given to the mother. Fourth and last step is non-separation of baby from mother and breastfeeding initiation. Delivery of the placenta. Immediately after newborn birth, uterine fundal size and consistency are examined. If the uterus remains firm and there is no unusual bleeding, watchful waiting until the placenta separates is the usual practice. Massage is not employed, but the fundus is frequently palpated to ensure that it does not become atonic. Observe for signs of placental separation, which includes globular and firmer uterus, sudden gush of blood into vagina, rise of the uterus into abdomen, and lengthening of the umbilical cord. Once the placenta passes through the introitus, pressure on the uterus is relieved. The placenta is then gently lifted away and care is taken to prevent placental membranes from being torn off and left behind. If the membranes begin to tear, they are grasped with a clamp and removed by gently teasing.